For years, the I-Team has exposed the impact of violence against healthcare workers.
Nurses, paramedics, even physicians targeted inside hospitals and clinics. Now, as senior investigative reporter Paula Vasan reports, there's a new plan to take action and better protect them.
It happens in a split second. Patients becoming violent inside healthcare facilities. Often it's against the very people trying to help them. It happened to retired paramedic Kayla McMahon. Nearly 2 years later, she still deals with PTSD from a brutal attack at this hospital's ER.
I had a stab wound right back here, right behind my ear, that I was lucky didn't go into my brain.
A woman came into SSM Health DePaul Hospital with a knife.
Bridgeton PD is also up there at the ER.
She stabbed a nurse in her head and neck.
DePaul is currently on lockdown.
McMahon rushed to help her coworker, getting stabbed herself. She later learned the attacker got past the security desk because no one was there.
You were so traumatized that you left the industry.
Yes, I did. I have not gone back.
When you first learned about this issue, what was your reaction?
Honestly, it was jaw-dropping.
Missouri Representative Justin Hicks just filed the first of its kind legislation in the state.
It gives the individual healthcare worker more power instead of the hospitals by itself.
The bill would prevent hospitals from requiring employees to restrain patients if they fear for their own safety.
It could be life or death.
Many healthcare workers say it could mean a new level of protection. Missouri does not have a state plan with the Occupational Safety and Health Administration, a government agency that enforces safe working conditions. It's why the nation's largest association of registered nurses says improved federal legislation is the answer. Hicks calls his bill a step in the right direction.
We have to make sure that we're protecting our frontline workers.
Putting more dollars into hiring security, he says.
I think it's great.
McMahon believes more security staff would have prevented her attack.
This bill says we can safely step back and say, hey, we're not comfortable. We're not going to take care of this patient that's trying to hurt us and or make our situation unsafe.
The president of the Missouri Hospital Association tells the I-Team he's got concerns about the legislation. He says it could actually make it harder for hospitals to care for patients, taking away tools like de-escalation techniques. In response, Representative Hicks says he wants to figure out a solution because healthcare workers should not go to work in fear. For the I-Team, Paula Vasan, 5 on your side.
And Missouri Senator Nick Schroer just filed the same statewide health care bill to prevent violence against healthcare workers in the state Senate. Lawmakers say filing bills in both chambers could make it more likely a bill will pass. If you have a tip for Paula and the 5 on your side I-Team, you can leave a voice message at this number, 314-444-5231, or just send an email to tips@ksdk.com. All calls and correspondence will be kept confidential.